What does the coronavirus actually do? For over 80% of people, getting coronavirus is like getting a common cold. Symptoms are often mild and not life-threatening. COVID-19 is most dangerous to the sick and the elderly. That is not to say that young and healthy people are not at risk as well. For example, Li Wenliang, the doctor who first noticed the epidemic, succumbed to the virus on February 7th and died at the age of 33. Many other healthcare professionals also died from the virus, but were not elderly or sick. So, why does the COVID-19 affect different people in different ways? For one thing, these healthcare workers are exhausted, responding to the crisis for weeks with insufficient rest, and that makes them more vulnerable to infection. As members of the healthcare team get sick, the workload increases for those still working, and that had a domino effect. The reason that some people respond to this epidemic differently than others is still not known. The common answers are undoubtedly true. The old and sick are more vulnerable. But children seem less so, perhaps because their immune systems are less likely to overreact. Since it is our immune system that keeps us healthy, it is also highly likely that the difference between a bad cold and a death lies in the individual differences in a person's immune system. There are two ways that the average person thinks about a disease. From a distance, we can talk about probabilities. For example, the flu typically kills between 250,000 to 500,000 people every year, yet we don't panic. Statistically, if the mortality rate of COVID-19 is 2% and 100 million people catch it, then 2 million people will die. When looking at it this way, it is understandably horrific. And that is the reason why the World Health Organization has taken this so seriously. So let's talk about mortality rate statistics and how that works. The breakdown of 81% is mild, 14% is serious, and 5% is life-threatening cases of COVID-19, with 2 to 3% of patients dying. That comes from an average that includes people of all different ages, sexes, and health conditions. However, these averages do not apply to any one individual because that is not how statistics work. For example, in a hypothetical sample of 10 90-year-olds and 10 5-year-olds, so 20 people in total, if all the 90-year-olds die and none of the 5-year-olds, then the average mortality rate is still at 50%. But the rate is not accurate for either group. So when you're seeing mortality rate statistics, it is usually across a very wide range of factors and not always accurate. Many cases of corona-related deaths in the media have failed to mention that the patients are more often than not either elderly or had pre-existing medical conditions or both. In addition to the problem with using average mortality rates in statistics, most of our statistics also come from China. And there's a problem because there are a number of factors that could change the death toll probabilities for the rest of the world. First, the Chinese in Wuhan are genetically fairly homogeneous, with few African, European, or Native American genotypes present. Why would this be a problem or throw off our statistics and calculations? Because different ethnicities carry different gene frequencies, and our immune systems are genetically coded. different diseases could react differently to different ethnities, as we have seen time and time again throughout history. Other factors that come into play, particularly in developing countries, is things like the standard of medical care available and sanitization. There's a lot of uncertainty due to the fact that COVID-19 is a new strain and most of the scientists are having to make educated guesses based on statistics and experiences from similar viruses such as SARS or MERS. The past epidemics were thoroughly studied because epidemiologists are constantly looking out for the next big one. Imagine, for example, a new disease that was as lethal as HIV that spread as easily as measles. Thankfully, COVID-19 is not the big one. We need to fight this epidemic with everything we have, but we do not need to panic. Statistically speaking, there is roughly a 1 in 2,000 chance of dying. The final death toll will depend on how many people will catch it and if a vaccine can be developed in time. Let's take a look at past epidemics for some perspective. The H1N1, aka the Spanish flu epidemic of 1918 till 1919, was the worst pandemic in modern history. It was a zoonotic virus that came from birds and infected 1 in 3 people on Earth. It also coincided with World War I, which meant that soldiers from all over the world were fighting in Europe and then bringing the infection home with them. 50 million people have died back then. The thing that made H1N1 so terrifying is that it killed people who were otherwise young, strong, and healthy. Every year we have a new variation of the flu, which is why we get a new flu vaccine every year. Some flu strains are worse than others. The big one could be some future flu strain, but COVID-19 is not as bad as H1N1. Ebola is another example of a viral disease epidemic. We have all heard about Ebola, which is another zoonotic virus. Ebola can have a death rate of up to 90%. So why aren't most of us dead already? It's because although Ebola is spread from person to person through contact with infected bodily fluids, the transmission is not airborne. COVID-19 is not as deadly as Ebola.